I think it's worth just getting started though, Lee.
Yeah.
And obviously, like I say, we're recording it. So if anybody feels like they want to share it with members of their team after today, if you just let us know, we'll kind of send that on to you.
So if I just talk through briefly the concept of the system and the reason that we're doing this, and then we'll move on to kind of a bit of a demo of the system itself. The reason that we are doing this is to provide a system-wide solution, and by system-wide I mean health, social care, the voluntary sector, and also for the workforce to be able to have a platform to feed in their feedback on engagement opportunities. Now, during the pandemic, I think possibly we all received lots of emails and everything kind of went digital, and there was a bit of survey fatigue that certainly crept in. I noticed myself, and the patient feedback certainly started to dry up somewhat. So we're looking for a more interactive and visual offering to reflect the changes in citizen behaviour, online citizen behaviour. You know, we're all using social media and websites and all that sort of stuff first, and we were forced to take a digital first approach through the pandemic. So we just wanted to make sure that we had something in place that was usable or kind of entice people to share their feedback. And that led us down a path of assessing what was out there. There was a lot of rapid development over the course of the past year on systems such as the one that we're going to show you today. And the way that we're approaching it from Joined Up Care Derbyshire, as Karen mentioned before, this is a 2-year subscription we've signed up to, and we've really tried to get cracking with it. The demo that I'll show you today is not a live demo. I just want a live site. I just want to be clear about that. I'm just trying to show people proof of concept, and I think today is one of the key steps in getting to where we need to go if we're going to have a solution that works for everybody. So it's got to be something that works for the people that are sharing their feedback. So that could be patients, the public, it could be staff. But it's also got to be something that is feasible for the people monitoring it and managing it. And we think it ticks all of those boxes. So today I'll kind of kick on, and I think the easiest way to explain it is just to show you, and then I'll talk through that of what we've got kind of a mock site up at the moment, a demo site for some opportunities in Derbyshire. And I know there's some people on this call, I won't name any names because it's been recorded and you never know where you quite sit with GDPR, but thank you to everybody that's shared any content that has helped us, you know, get on to the place that we're on today. And I'll now just kind of whip through those if I can share my screen. Hopefully this is going to work okay. It's always that kind of anxiety of, is it going to screen share okay? So can everybody see that? Is anyone else able to give me a bit of feedback if that's coming up on screen now? Yeah, that's fine, Lee, we can see it. Brilliant, fantastic. Phew, well, that's the first kind of worry out of the way. So like I say, I'm just gonna, we've mocked up a demo site. These are all real things that are going on at the moment within Derbyshire and Derby, and I just wanted to get across to people how it could look. This is one of 3 hubs that we are focusing on getting up and running. This is the first hub that providers and of health and social care services could use to advertise their engagement opportunities to get people involved. And we've also got, if you can see my mouse, so this is the Joined Up Care Derbyshire Public Engagement Hub, I'm calling it at the moment. We also plan to have a staff hub, which will be for the workforce and people to feed in on that. So that will be like a separate one, almost a separate website, if you will, similar theme. And and we'll also have an offering for the voluntary and community sector. So we really do want this to be something. I know today we've got a lot of stakeholders from across the board. We really are planning this to be something for everybody to use, and we're hoping today to be able to generate some interest in people wanting to feature any engagement opportunities they may have. And then if we can collate all those, we can start to prioritise and get moving through. As it's a subscription-based service, we want to move this as fast as we possibly can, also to keep up the kind of momentum we've built with the pandemic. And I mean that in a good way, in that, you know, there's lots of changes to services, but there's also a real willingness, has been a real willingness for people to get involved, for people to have their say. And we want, hopefully, this is a solution that will enable that in a more open, transparent way, in which people are also able to be fed back to. So I know I've been in patient engagement myself a long time. It can often feel like, you know, people have fed stuff back and they might not hear anything back, or a service change from their feedback might not happen till 3-6 months down the line. There's some functionality within this system that will enable us to kind of show the changes that have been made from that feedback, but also make it a little bit more engaging to get people to share feedback in the first place. So at the top here, we've just got kind of a little description of what this hub itself is. So we're focusing on the one for really providers today, providers and commissioners of health and care services. So we've got the projects tab, and down here you can see I've just got 4 kind of test projects. They are real kind of live things that are up and running, and following today's session we'll be looking to kind of update these and launch the hub, this hub, later on this month as quick as we can. We didn't want to miss this step though, because I think getting the buy-in from the people that are running the services, the people that commission the services, and it's great to see the attendance rate and the type of people attending, because unless we're all kind of willing and open and honest and happy to feature our engagement opportunities and do it at the earliest stage, then it's going to kind of provide barriers to a system such as this. So hopefully today's a step towards, you know, showing how that can be done. So if we hover over this first one, we've got long-term condition hubs. That was I was at a session last week, a fantastic session, facilitated by, in part by Joined Up Care Derbyshire, but providers ran that session, and it was a webinar. Now, what we have here on this hub is basically a slightly more interactive offering than you would find on a website, a normal website. It's, as you can see, it's very visual, more aesthetically pleasing, and it's got, as you can see in the top right corner, it's got that kind of social feel to it that most people will be used to these days. There's options to share these opportunities. So for the long-term condition hubs, you could, you know, if there was somebody you wanted to get engaged with this, or a member of the public came onto this, they'd simply be able to click to share this and notify them by clicking on the tweet or Facebook button and writing a message. It starts off, and I mean, I've just been playing about with this myself the last week. It starts off with a little introduction as to what the engagement opportunity is about. I've taken this from a slide deck kindly shared with us, and then it's about getting people's views on whether moving services towards a more centralised hub for people with long-term conditions is going to be better for patients than it currently is. That's quite that's shown somewhat there in these 2 images in a short, concise way, but we're trying not to be too text heavy to keep people engaged, because we feel that we'll get more back off people that way. And we've also got, I'm just demonstrating some of the kind of functionality of the system here. We've also got the option to say to people, do you think long-term condition hubs would help to improve services? and as you can see there, it will live update, and once we go live with this platform, we'll start to get lots of votes, hopefully, and that will cause a snowball effect for other people. Once they come onto here and they can see other people are using it, it's easy to use, it's interactive, then it'll get people talking. Down in the bottom left, we've got here an ideas board. You can see here I've just kind of put a test one in there, and then a suggested kind of access one where I put ensure any potential hubs are easily accessible via public transport routes. People can come onto this board and add their idea. It's going to take ages to load now. If I'm doing it on screen share, maybe, but if that doesn't load in a second, I might just X off this because, yeah, I'll leave that be. It's because I'm doing it via screen share, sorry, but it just gives people the ability to add an image and share an idea. And as you can see here, other people can see those ideas. When this site goes live, this is in demo, people will be able to vote on those ideas, say if they think it's a good idea, a bad idea, that sort of thing. We've also, saying on the long-term condition hubs, there were 2 focus groups, one I alluded to last week, and you can just kind of show what's been done to help engage with people on these issues. The one on the 27th of May that we went to was really good, and it just gives people an opportunity to, I know these are past events because it happened last week now, but if this was a live event, you know, it could be give up an opportunity to advertise it and get people to sign up. We've got here a project contact widget on the right hand side. I've used myself. I'm not the project contact for long-term condition hubs, but it was just a case of time and getting people's permission. So you'll notice throughout this that I've just used myself, just to show how it could be used for particular projects. But obviously, anybody wishing to feature a project on there, you would use your, the lead contact for that project. And we've also got the functionality on this one to ask a question. You can see on the right hand side there's a project contact, you know who that's going to, so it just starts to get people talking, and starts a certain networking element as well. So that's the long-term condition hubs one. I don't think I touched upon the translate feature. We've built this with accessibility in mind. It is a really good system, and it will, quite easily change the text, as you can see there, into a different language. So any kind of text that isn't on an image block will go into, one of the hundreds of languages powered by Google Translate. So I'll flick that back to English so I know where I'm going, and come back on and quickly go on to one of the other demo tiles that we got up. So Derbyshire Dialogue, here's one I'm a little bit more familiar with myself, because this is something that we as an engagement team deliver ourselves. We hold a session roughly once a month on an issue, on a particular issue. And again, for this project, we've got kind of the introduction of what Derbyshire Dialogue is, how it works, what the next session is. Up here on the top bar, you can see in quite a nice user-friendly way that the sessions that we've held over the last few months. So it starts to get across to people that, I know there's so much work being done across the system, and it starts to really kind of get that across to people in a way that's not overfacing them with information, not too much text, a nice visual way. And it also kind of gives you that ability to show future opportunities. So we've got these that have been held in the past, they're real ones. And if we scroll down here, you can see those. I've simply added them, and you can click play. You can click play on that, and that will go straight into it. I don't know if I've clicked include computer audio on my Teams share, so you might not have heard the volume, but when it's live you will do. We're advertising the next session we're holding, and you can see there that's on the integration of care in Derbyshire. Again, nice, clean, user-friendly interface, and people are able to register for upcoming events. On Long-Term Conditions Hub, we were showcasing a past event. On this one, we've got a live event where you could click onto, and it would take you through to register your attendance to come to the integration of care in Derbyshire, Derbyshire dialogue session. I think John and Chris are at that one, and it would be, I think it's going to be a great session. So yeah, just shamelessly promoting that whilst I've got you all here. Again, another kind of keeping it interactive. We always have within my team discussions on, well, what's kind of, what's the topic that people are most interested in, and we kind of toss that about between ourselves and figure out what the next session is going to be. Well, if we can start to get people to come onto this system, then those ideas, we can start to get some public input on that. So some potential, sessions we're thinking about holding the next Derbyshire dialogue session on with about the medicine disorder line, the way that you order your prescriptions, or waiting times and service recovery. So by featuring that on here, people can come on and vote, and we could get, it's all right for us from a staff point of view, but sometimes you can't see the wood for the trees depending on what your current workload is. So it's nice to get a public sort of view as to what would the public like to hear about and respond to that. It's in keeping with that, reflecting, what the public want. We're kind of making this to be a system that they would use, not something that suits us, something that suits them as well as suiting us. And then we've also got the ability to ask a question if people have got any suggestions for future sessions, or just to get in touch or something like that. So that's the second one. The third one I'm going to go on to here. Now this one is a slightly different one in the way that it works. Now, I don't mean that in terms of functionality, I suppose more the project itself, but this is a more volunteer-led project, and it's supported by chairs from Derby University Hospitals, Derby and Burton, and Chesterfield Royal, but we've also got volunteers on here, and it just gives, I know there's a Derbyshire Maternity and Neonatal Voices Facebook page, but it gives the people involved in this project a platform that perhaps looks a little bit more professional and gives them a lot of functionality and tools to be able to engage with their users. What I haven't done yet is dragged through this this Facebook preview bit, which is just in terms of the time I had to get things set up. But if we were to click on that, then it's going to take us through to their Facebook page. Just get rid of that first. So as you can see here, yeah, that did load. It takes through to the Derbyshire Maternity and Neonatal Voices Facebook page, which at the moment is the single thing that we have running for that. There is no website or anything, so it's great to be able to add an additional kind of string to the bow for them. If I'll leave it to Matt, actually thinking about it, to show the mobile view. With me being in test mode here, I've not quite got all the functionality that you will have when this goes live. So I'll just come on to the final kind of test tile that I've got up and running, which is about the Derbyshire Patient Participation Group. This is something we're working on at the moment and we want to support as a system. It's about people that are attached to their GP practice, so interested patients. Again, we start off with the intro. We've got a nice visual heading. It gives the option for you to, as it does with all the other tiles, to follow this project. So you can kind of sign up to receive updates on it about the different opportunities that are coming up. We've got the introduction again, just explaining what it is. I'm going to stick more to the functionality of the system than to the kind of content of what a patient participation group is and how the network might work. But what we've got here that's slightly different to some of the other pages is the map view. So it gives you the ability to plot, and this can work in lots of different ways. I've just kind of trialed it out for the PCN areas, and you can start to see on the map here the different services we've got. So I've just plotted a few GP practices that I know have a patient participation group. And if I click onto that one, we've got Dronfield Medical Practice, the chair of which has been helped us all the way through the process of deciding which system to go for, what would the needs be. So we're hoping to be able to take it to quite a granular level in terms of providing a service for everybody. So, you know, even down to hopefully the individual PPG level. But it's probably something that, and I know speaking to the chair of that group, it's something they were struggling with because they just didn't have a system to do it. We're offering the ability to, you know, feature on here and have a system. And again, it's keeping things interactive. It's keeping people engaged. So we've got, you can see that little kind of pulsing bit. It's all those things, the user experience. I don't want to go too techy and stuff like that. But just to get people kind of clicking and interacting, that are all going to help us to get people to share their feedback. We've also got an ideas board down here on what could help improve your GP practice, and people have the ability there to click on and to share their idea. I'm not going to make the mistake of clicking that to load over a screen share again, in case it doesn't, because my internet isn't great today, I'm afraid. Now, as we move down further on, so this tile was about the patient group network, but we've also kind of got, I wanted to showcase something that came within that. So relevant to the patient group networks is the medicines order line. I know that's an issue in the last few years that I've heard a lot about myself personally, and it's a way to order your prescriptions online. And during the pandemic, it's not online, sorry, over the phone. And during the pandemic, there was an incredible increase in the amount of calls to this service for obvious reasons. So you can see here, and what I'm trying to get across, and I've just done this myself from a slide deck that someone's given me. So, but the point I'm trying to get across is that it can be useful for you as a provider to show that whilst I've personally heard, you know, lots of feedback about the medicines order line or people struggling to get through, it gives you a route as a provider of the service to say, well, actually, look, we've had, you know, during 2020, 2021, we've had 1.1 million calls handled. You know, we're serving 675,000 people at the moment. You know, we've made a lot of interventions and we've actually helped to save a lot of money. There's also useful things such as the call times, so this traffic light system that helps to show people when the lines are going to be particularly busy, and things like that. And in the text up here that you would read if you were somebody coming, a patient or member of the public coming onto here, it's kind of pushing people to say, look, you know, this service has been incredibly busy. They're doing a hell of a lot of work, but there are alternative ways for you to order your medicines, such as the NHS app, which I think's just kind of jumped down to here as I've gone on to present mode. But the more people that can start to use the app, the more it frees up the phone line for the people and reduce waiting time for the people that don't have internet access. Again, to the right hand side, we've got just some how do you order your prescription. So that's just getting people to think, look, there are different ways, you know, things are changing, things have changed. and we're just trying to get services as best as they can be. So to put these sorts of things into polls and get people thinking, it just, you know, gets the cogs turning and thinks, actually, you know, I could perhaps use the app. There's no reason I couldn't. And then that's going to start to free the phone lines up for other people that need to use them, and perhaps those Mondays won't quite be as busy as they have been, and those 1.1 million calls could drop down, as well as the app for those that have or can use it. It's a much better, easier way to order your prescriptions. So I've covered, we're at 11:30 now, so I've covered kind of this mock site. As I say, it's not at a point where it's live. This is the kind of stakeholder buy-in session to generate interest from everyone, showcase what it can do. So I'm going to hand over to Matt now, who will present much better than I do the capabilities of the system, and then we'll do a Q&A at the end. So if I stop presenting there.
Thanks, Lee. That was awesome, by the way. Looking really good. Yep. So Lee showed you what he's created over the last few days, which I think is a great start. What I want to show you then is how easy it is to do some of this stuff yourself from the administration side of things, because when it comes to engagement, we want to give you the power to do a lot of this stuff yourself if need be. So I'll go ahead and share my screen, and we should see that any moment. Okay, and there it is. It's not quite as exciting as what Lee showed, but essentially what we're seeing here is the administration side of the platform. And you saw the various kind of tiles and projects or consultations that Lee had created. What you can do as a user of a system like this is log in and see a list of those various projects you've got active. And you can then click to start editing and to build the various widgets that are available. And we can certainly share a full list of those widgets following this session. But if I was to do that here, so you see this sample consultation, I'm going to go into this and click edit. And this is the view that Lee would have started with for each of those projects, like this kind of blank canvas. And what you can do is simply go, okay, I've got my blank kind of page. I now want to add a widget to this page. And so what I can do is click add widget. The system asks me what type of engagement widget would I like to add. Now this is where you can choose some all different types of widgets. It could be something quite simple like some text, overview, image, that kind of thing. Or it could be something more detailed like an FAQ, the ideas board that Lee showed, or a life cycle or calendar. You can even have things that are more interactive, like comments, where people can discuss back and forth, or indeed like the map, where you can display locations. You can even have a map where people can pin and add a comment, so you can get feedback kind of with geolocation tagged. And in this instance, what I can do is say, okay, I want to add, let's say, some documents to a page, maybe some PDFs or something like that. So I can click on the documents widget. I can upload documents to the system, or I can select some existing documents. So we'll pick some random ones that we have here, and we'll add them to the widget. We'll click add widget, and it's now put that document onto the page. What I'm then going to do is go ahead and move that into position. So we'll give it a little margin on the right-hand side, and we'll have it on the right here. So I've simply just drag and dropped that into position, and we'll click save. I'm now going to add a second widget, which is, let's go with some overview text. And we'll turn off the title. We don't need a title for that. And we'll say, this is my introduction. Just something short and sweet for now. Click add widget. Let's make that a little bit smaller because there's not too much text to display. And we'll move that across a little bit and click save. And you can repeat this process as many times as you want. So you can add more and more widgets. You can get more and more details with the content you're adding. But the idea is that you don't have to be a technical expert or a tech wizard to do this stuff. You should be able to do it as a regular, everyday person. And in this instance here, now I've saved my layout, I can go ahead and preview it. So I can click on the top right and I can load up a view of the page so I can get an idea of what we've built. So in the few seconds we were doing stuff then, we can see we've built this page with my documents and the text. And of course, what you might want to do then is switch between different views. So this is like my extra wide desktop view. Some people might be on a laptop, so it'll condense down to be smaller. You may have a laptop kind of view, and then you may have people who are on mobile, lots of people on mobile. And what you'll notice is that whatever content you add, whatever widgets you add, they will always be responsive and adapt to the resolution and the screen sizes that people have on their devices and what they're using. So it's very kind of user friendly from that perspective. And the final thing here is on the left-hand side, you have a bunch of different settings you can change. From the status, is it an open project or consultation? Is it closed? Is it in review? If I want to change the imagery, the title image or the background image, I can do that. And then you notice the various kind of options that Lee showed with the share button, the follow button, the translate button. You can turn them on or off as needed just by toggling these options here. So the idea is that if you had access to the site, you could build out one or more of these pages yourself. And because what we're trying to do here is give some kind of structure to how engagement happens, we can also have an approval workflow. That means if you make a change, it can go for somebody else to review, to look over that change, then click OK, I accept, and to publish it. Or they could reject it and give you some feedback as to why, what needs to change. So we're putting some kind of structure in place to make sure the engagement that we're having is consistent across the region. So that's the first thing I wanted to show you. The next thing is around surveys, because what you'll no doubt find is you'll have these pages live, but at some point or other, you're probably going to ask people some questions in a survey format. It's a very key way of engaging with people. And so what you can do is click on the main menu here. And if I was to click on campaigns, this is where all of my kind of feedback campaigns or surveys are currently stored and are active right now. And so you'll see there's a whole list of different ones that I've been playing around with. And there's one here called hospital parking. If I click on this, what you'll see is that I've created a survey with some kind of custom branding. So I've added a background image, I've added a logo, and I've added some different colors. So the first thing here is that when I create a survey, I want to make sure that people connect with the brand. I'm giving them a way to answer questions in a very, very user-friendly way. So you have the ability to change the styling and the branding from within the system. Then what you can do is click into a survey like this and go into what we call a scripting view. And this is where you can start to add your questions. So here we've got various questions about people's visit to a hospital. We can, of course, drag and drop to change the order of those questions. And we can click plus and add new questions below or above if we like within the survey. So the idea here is that you can build out your surveys in a very, very user-friendly way. If I was to add a question, you'll see on the right-hand side, it gives me a visual preview. So we could add maybe a date selector, so we can select a date. Maybe we want to add some free text or a map or a matrix. Probably one of the most common types of question is a multiple choice, so we'll add that. We could ask our question, do you think the parking charges were fair? We could say yes, no, just okay, whatever inputs you want. We see our preview on the right. Maybe we want to have an other option. Maybe in some circumstances, you want to randomize the options to remove bias, that kind of stuff. You can do that. And typically, you'd go through and add your questions to a page like this. At this point, you can then share this survey with the general public. So you can create a public link to the survey, which is done automatically if I take a step back. And so you could paste that on Twitter or on the website, or embed it on a project page, or send it via email. You can really, do whatever you want with that link. You can even do things like generate a QR code if you want to put it on posters or around in different places. And I can also go and preview it. One of the other things you can do is actually send a direct survey invite to people that are registered to the main engagement site. So basically, there's a section of the site which Lee didn't show on his demo, but it basically allows people to register and to create an account. And typically when they do that, you would ask some demographic questions. And then what you could do is say, well, I want to send this survey to all people that live in this town or within 5 miles of this town. And they would then receive that invite, and you could send that via email or SMS if you liked. So you've got different communication channels built in. And we can see here we've got some questions appearing on the page that I could then click through and for an answer. What's really neat about this is when you ask questions like this, the key to the reason why you're doing this is because you want to get some data to probably back up or help you make a decision. And what you'll find with the platform is that whenever you create a survey, you will get a dashboard or a visual to go with it. So what I can do here is click on dashboards at the top, and you will see a bunch of different dashboards that I have on my system here. I'm going to click on this parking 2021 dashboard, and it's going to automatically pull all of the responses and put them on a page so I can see what the breakdown is. The key information is at the top: number of responses, dropout rate, average time to complete the survey, that kind of stuff. Then we've got our actual response and our questions. And in some cases, maybe I need to drag and drop to resize and make it a bit more readable. So you can go ahead and do that. When you have a view like this, you can export the PDF if you like to share with people. You can even save the layout and send it as a public link to different partners and team members. And so they can see the data in real time as well. But one of my favorite things is to actually start digging deeper into the data. So what you may do is go to the dashboard list, and under actions, you have like this table option. If I click on the table option for my parking survey, I get a view of the questions. And this is something that some of you may do in Excel right now. You may export the data to Excel and do some of this. And you can still do that, but you don't have to. What you can do is open up a pivot view, and then you can drag and drop to create your crosstabs. So what I'll do here is I'll compare what was the purpose of your visit to the hospital. Again, how long did it take you to find a parking space? What that's done is create a crosstab or a pivot of those two questions. Let's add a heat map to make it a little bit more readable. We see right away that this is an outlier. It's red. We see that people that go there for an appointment for a family member or friend, it takes them usually 30 to 40 minutes to find a parking space, whereas for other people, it takes much shorter. So it's kind of showing us some intelligence, and we can find that out quite easily. And then, of course, we can run some type of statistical function on top. Maybe you want to just do a percentage to see the breakdown and so forth. So hopefully this makes the process of analyzing data very user-friendly and fast. We want you to be agile. We don't want you to spend days exporting and trying to figure out how to process and clean data. We want to give you the tools where you can drag and drop and move quickly. The final thing I want to show on dashboards is if you are quite tech savvy and you want to export the data into some other tool, you're free to do so. The system is fully open, so you can download this data into Excel, SPSS, and other formats. And one of the things that I like to do is actually load it into Power BI, which is a business intelligence tool. You could use Tableau or Click. There's tons out there. But if you do that, what you can do is bring the table into or bring the data into a dashboard that is fully interactive. So this is some sample data from the US. And you can see this is a survey where 373 people responded. And everything you see is interactive. Because of the way that the platform stores the data, I can click and say, well, I want to see all the feedback from people that identify as Caucasian. So I can click on the Caucasian segment, and we'll see that shows us a segment of 251 people. So I've refined that data down. Maybe I want to see all the feedback from people that identify as Caucasian and they're also married or have a partner. So I'll hold control and I'll combine those two things. So now I'm seeing 133 people. And so I'm digging down, I'm drilling down into the data, and maybe you want to do this by region or by demographic and so forth. And of course, being in the Derbyshire region, over such a large area, one of the things you might like to do is compare results between maybe rural versus urban areas. So if you to switch to a map like this, you can actually draw a geofence. So I could say, well, show me all the feedback in the north of the city, draw the geofence, and now I can see feedback from just those people in that area. So that's just an example of the power of what you can do when you've got the data like this. And the final thing I wanted to say, just to close this out, is if you're accessing the platform, Lee and the team has the ability to change the roles and privileges so they can give you access to individual surveys or individual projects, and make sure that you're not overwhelmed with data, that they can lock it down and you see what's relevant to you. And Lee, is there anything you'd like to add to what I've shown there?
No, that was great. Thanks, Matt. I think it's really useful to be able to show that, I mean, from that front end side that I demoed at the start, that this is something that can be really, easy and simple to use and interactive from that front end, but it's also an incredibly powerful tool. But I don't want people to be put off by that, because we don't want this to be an offering for the few. We want it to be something for the many, as Matt mentioned there. And the system level support, the whole premise of this system, the way we're building it out, the way that we're setting it up, is that we'll have templates, we'll be able to get people up and running, but this is something you'll be able to manage yourselves over time. And it is an ambitious way that we've gone about it really over this 2-year period, and having we're going to have a hub for the workforce, a hub for the voluntary and community sector. But I think, if we're going to collaborate, and we're going to collaborate at scale, then let's do it properly. And I think this gives something for everybody. We've been answering some questions in the chat box, and I just wanted to touch upon one from Donna about, how are we going to get people, how we're going to drive people to this system. And I mean, I've run many websites and things and social media campaigns and all that sort of stuff, so I do understand kind of the challenges that can be. One example just from the last week that would have been really useful is myself and Miriam helped facilitate the long-term conditions hub focus group. So there were 15 people there, got some fantastic feedback on the day. It was kind of an hour webinar session where the providers were talking, and then the service users were talking. If we simply dropped the link to a long-term conditions hub, as I demoed it earlier on, I'm sure they would have all given feedback, and it's much more user friendly. They can then click to follow that project tab, and they can sign up to get updates, at various different levels to suit them. It has to suit the user. And as Karen mentioned in the chat box, we're going to accompany that with a large marketing campaign once we have a really kind of topic on there that's going to have large public interest. That's not my baby. Once we have a topic on there with large public interest, what the next stage is now, we had to do this to get the stakeholder buy-in to show it to the system, so we can generate the interest. The next stage is to actually turn it live with those projects we've got in, update them somewhat. Then we're going to go into, without getting into tech talk or marketing speak, a soft launch where it will be live, it'll be there to direct people towards. And then a couple of months down the line, or a month down the line, whatever, we've got that big topic on there with large scale public interest, and we've got some other tiles on there that people have started to use. Then we're going to accompany it with a marketing campaign. So that's one of the ways it can be used. Karen, is there anything that you wanted to add in before we go to a bit of a Q&A?
No, Not at all, but it's really good to read in the chat that everybody is excited about it as we are. And obviously, the more interest there is in this platform and the more you're wanting to use it, the more successful it's going to be, basically.
Yeah, I think that's a salient point. We're approaching this from the point of view that, look, we can provide a system, we can provide at scale, we can, we can put something out there for everyone to use, and we've spent a lot of time assessing different systems to make sure it is easy to use, both from the front end and the back end. It's also powerful if you need to go down that route like Matt did with the surveys and things. So there is something for everyone, but we kind of need everyone to start using it, and it, and that in part is why we've held this session today. Don't worry about the baby noise you've just seen in the chat. So I don't know if via people want to put hands up, or if there are any questions people want to put in the chat box that we can fish out, and between myself, Karen and Matt, we can answer that may not already. Yeah.
Oh, sorry, Lee. I was just going to say, for the sake of the recording, Nicola asked a really good question earlier, which Matt answered, which was around accessibility. So she said, language translator facility is fantastic. Does it also support those who are visually or hearing impaired? And Matt replied to say that there's going to be, well, there's already screen readers and other accessibility tools. You can use imaging tools, alternative text. So I just think that's a really good, useful tool around involvement for us to be aware of. Yeah,
just to add on to that, and in the last week in getting those demo projects up, each time I added an image, there was as Miriam said, an alt text box. So people that do have, visual impairments and things like that would tend to have a screen reader. So the way that we're setting it up, and this will come in the guide, is to, if there is an image, there'll be a caption tag. And I really like that there was within this system. And then I would type in what that image was. So if you had a screen reader and it hovered over that, it went over the image, it would read out what the image was. So from that point of view, it was quite, yes, I would say it is as accessible as we can get it, really.
Yeah, and there's a question from John as well saying, this is excellent. Have we given any thought to how we'll support people in rolling this out, e.g. briefing, training?
I think I saw a chat in comment in the chat box from somebody from Civica that kindly said that there's a guide that we're going to send out. Today, we want to generate the interest, and what I'd love to do is, you've got our email addresses and we can put them in the chat box, myself and Karen. If we can now collate from people that are interested, what projects we may feature on this platform, we can start to kind of pull that together and work out the process of, a streamlined process of that system support. And the more we do it, the better we're going to get at it. And we'll come up with a set process where this is what we do. And, it's over a period of 2 years. But again, and certainly with Karen kind of always looking to keep the ball rolling and move on, we're going to get things moving fast. So yes, we've got to figure it out somewhat, but I go back to the fact that it is really user friendly. I've done all that in the past few days mainly, and I think that there's enough kind of capacity within the system and user guides to get people up and running. Once the more projects we have on, you can duplicate templates. So if you find something you like, we could just duplicate that, and then you add your own you add your own text in, you add your own images, that sort of stuff. So yeah, I think that's how we'll approach that.
I just wanted to reiterate as well what Lee said. If you just be patient with us, we will work all this out. But it is a big project. It's an ambitious project, so there is a little bit of detail that we still need to figure out, and we will do that. So
yeah,
a couple of questions about soft launch and when we're going live with it as well.
So Karen, do you want to take that one?
Well, as Lee says, I've been, because I mean, I know 2 years sounds like a long time, but I know that 2 years goes really quickly. So we are hoping to do a bit of a soft launch by the end of June, beginning of July. But like Lee says, we're not kind of going live with the major comms campaign till we know that it looks really impressive. Because when we go out to members of the public and say, look, we're here, we want them to go to the site and see, lots of really good stuff going on there. So the soft launch will be the end of June, beginning of July. And then once we feel like we've got, a fantastic project to kind of really push, and then we'll go for kind of that major campaign. But bear in mind as well that, everybody that has a conversation on there is when they do their own kind of marketing of their campaign, they're driving people to the site. So you're going to benefit from everybody else's kind of marketing of their conversation, because once they've got to the site, they'll see other conversations that are going on and they might want to get involved in those as well. So, all the time that any one of us is driving people to that hub to have a conversation about our project, you're also driving people to have conversations about other people's projects. And I think that's the beauty of it, really.
So there's no other questions in the chat box at the moment. There's lots and lots of really positive comments about how the platform will work in different areas. That's brilliant to hear.
Okay, fantastic. Well, yeah, just to reiterate on the point that Karen said, and say that from a marketing perspective, there's different levels of registration, and each of those projects you could sign up just to be interested in one project, or we're merging this with a different Joined Up Care Derbyshire initiative that we previously had called the Citizens Panel, and that's where we've got a group of interested citizens, about 1,000 people, and they can basically get a monthly update or change their preferences to be updated about a variety of things. So we're looking to build that up and up. And just general registration to the system. One feature I don't think I touched on was social login. People can come into this, and I know this because I do it myself. If I have to type my email and name and address in, I don't click to register. With this, you can just sign in with Twitter, with Facebook, with Gmail, something like that you're already signed into. So it's a one-click process. We know you lose people with each click. So there's lots of things there with this system that will help to build the number of people that are interacting with it up. And the more we have, as Karen says, we want to get that snowball effect going, which is really important that we do it in the manner that we're doing it, so that when we have a marketing campaign, it kind of runs from there. So unless there's any more questions, no, then I'd just like to say thank you very much to everyone for taking the time out to come here today. I appreciate how manically busy everyone is at the moment. But this was, if we hadn't have done this, I don't think, the next step would have been too soon and it wouldn't have worked. It wouldn't have worked as well. So thank you for coming. Thank you to everybody that's helped for those projects that we've demoed today and was also involved in assessing the many different systems. And to Matt and Civica for putting up with us, absolutely grilling them to make sure we got the right thing in the end, which I do believe we've had. So thanks very much. And we've finished on time, which is also great. So yeah, any questions, like I say, any interest, just get in touch with us and we'll work it out from there.
Thanks, Lee. Thanks, everyone.
Cheers.
Thank you.
Thank you.